IV cannula selection across age groups. Welcome to the Advanced Technology Center, ATC, online training series. In this module, we'll explore how to choose the right IV cannula based on patient age, vein size, color coding, and flow rate. Understanding these distinctions is essential for safe and effective IV therapy, especially in diverse clinical settings. Why gauge size and flow rate matter. The gauge of an IV cannula refers to its thickness. The smaller the number, the larger the diameter. Each gauge offers a different flow rate and is selected based on the patient's age, condition, and the purpose of the IV line. Let's break this down by age group, starting with our smallest patients, neonates. Neonates, 0 to 28 days. In neonates, we primarily use 24 gauge cannulas, which are yellow in color. These have an external diameter of about 0.7 millimeters and a flow rate of approximately 20 milliliters per minute. Since neonates have tiny and fragile veins, we prefer scalp veins or dorsal foot veins. Secure the cannula gently and use a syringe pump to administer medication slowly and accurately. Overinfusion can lead to fluid overload, so close monitoring is essential. Infants, 1 month to 1 year. For infants, both 24 gauge, yellow, and 22 gauge, blue, cannulas can be used depending on the size of the vein. The 22 gauge cannula allows a flow rate of around 36 milliliters per minute, making it ideal for hydration and medications. Common sites include the dorsal hand and scalp. Always stabilize the limb and check for signs of infiltration regularly. Toddlers. In toddlers, 22 gauge blue cannulas are still widely used. Veins are larger than in infants, but still require gentle handling. Aim for the dorsum of the hand or forearm. Avoid joints to maintain mobility. Flow rates are sufficient for basic hydration and medications. Children, 4 to 12 years. In children, 20 gauge cannulas become the standard. With a flow rate of approximately 61 to 65 milliliters per minute, they're suitable for faster fluid administration and common medications. Use the hand, antecubital fossa, or forearm veins. Ensure secure fixation to accommodate active behavior. Adolescents, 13 to 18 years. Adolescents can tolerate larger gauge sizes like 18 gauge, green, which offer up to 90 milliliters per minute. This is especially useful in emergency settings, surgery prep, or blood transfusion. Select larger veins in the forearm or antecubital area. Adults, 18 to 65 years. In adults, cannula selection depends on the purpose. For routine medications and fluids, a 20 gauge, pink, cannula is sufficient. For rapid infusions, blood transfusions, or trauma, opt for 18 gauge, green, or even 16 gauge, gray, which can deliver 180 milliliters per minute. Use the largest visible straight vein available, often in the forearm or antecubital region. Older. Adults, 65 years. Older adults have fragile veins and reduced skin elasticity. It's best to use 22 gauge, blue, or 20 gauge, pink, cannulas. Avoid large bore cannulas unless necessary, as they increase the risk of vein rupture and infiltration. Be gentle during insertion, and always monitor for signs of phlebitis. IV cannula selection based on age group, as outlined in the table below. Final tips for clinicians. Always assess the vein size, visibility, and clinical requirement before selecting cannula. Choose the smallest gauge necessary to preserve vein integrity. For high-risk medications or poor peripheral access, consider central access. Monitor IV sites every 1 to 2 hours for signs of infiltration, redness, or phlebitis. Label all IV sites with date, time, cannula size, and initials. Mastering age-wise cannula selection is crucial for ensuring safe and effective intravenous access across all patient groups. Choosing the correct cannula size based on age, vein condition, and clinical needs helps reduce complications, improves patient comfort, and enhances treatment outcomes. For more practical clinical videos and learning content, visit www.healthcare-eskilling.com. Thank you.